Hello everyone, I am Yashodhara Gunasekara from Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. My research topic for today's presentation is pattern of antimicrobial resistance in Escherichia coli isolated from livestock and wild animals in an urban and a rural ecosystem in Sri Lanka. Antimicrobial resistance can be the next global pandemic, so potential research on the extent of antimicrobial resistance will be beneficial in addressing this crisis. As shown in figure 1, we can see wild animals can be exposed to antimicrobials via livestock and environment. So we studied wild animals is an indicator of environment contamination. Then as shown in figure 2 and figure 3, we select 1 square kilometer area from Dompe as urban ecosystem and another 1 square kilometer area from Dambana as a rural ecosystem. Then freshly voided fecal samples were collected and isolation and identification of E. coli were performed according to standard protocols. And then antimicrobial sensitivity test was performed for commonly used antibiotics according to CLSI guidelines. Let's see the results. As shown in figure 4, in Dompe, around 50% of E. coli isolates from livestock and wildlife were resist for at least one antibiotic be tested, whereas it was around 4% in Dambana. And also, as shown in figure 5, in Dompe, highest resistance was observed for ampicillin followed by tetracycline and nalidixic acid. And also, comparatively low resistance was detected in Dambana, in a rural ecosystem. Altogether, our results suggest highest resistance was observed for commonly used antibiotics in both livestock and wild animals in urban ecosystem. Further, the difference between urban and rural suggests there is more environmental contamination of antimicrobial resistance E. coli in urban area. Thank you.
The title of our study is Dietary Habits of Advanced Level Students During COVID-19 Pandemic in Colombo District, Sri Lanka. Poor eating habits is a major risk factor of non-communicable diseases. Our objective was to describe dietary habits during COVID-19 pandemic among advanced level students in Colombo District. A descriptive cross-sectional study was conducted using convenient sampling technique among 480 students using a 3-day dietary recall. Data were collected in January 2021 and the analysis was done using SPSS 26th version. Nutritional adequacy of the diet was assessed by food pyramid with number of portions and the dietary diversity score based on food-based dietary guidelines Sri Lanka. Out of the participants, 2/3 were females. Breakfast was the mostly skipped meal. Consumption of different food types in recommended number of portions per meal as follows. Starchy foods 97.1, vegetables 67.5, fruits 30.2, proteins 71.7, dairy products 25.8, nuts and seeds 21.3. According to dietary diversity score, 50.6 had consumed 4 or more than 4 groups of food out of 6 food groups mentioned in the food pyramid, which was considered as a nutritionally adequate diet. Only 6% had consumed all 6 varieties of foods per day according to DDS, and according to food pyramid, that percentage was 4.8. 71% had consumed at least one sweet item per day, 54.5 had consumed savory snacks, and the fast food consumption was 31.7. 54% had indicated that their daily water intake was more than 2 liters. As a summary, consumption of a variety of food groups and a balanced diet was low, although the nutritional adequacy was satisfactory. High snack consumption was reported. Thank you.
Hello everyone, I'm T.G. Jain Gamage, presenting our research on public perspective on the uses and indications of surrogacy within the Sri Lankan context. Surrogacy is an assisted reproductive technological method which is widely used in both local and international contexts. Since in the local context, legislature is non-existent, it would be important to gauge the public perspective on the topic. This was a descriptive cross-sectional study conducted by a snowball sampling method with a sample size of 431, which consisted of 20 to 40-year-old general public of Colombo district. Upon assessing the association between multiple socio-demographic factors and practical day-to-day scenarios, participants in general preferred the usage of surrogacy as an option to conceive a child for a woman who is medically incapable of achieving pregnancy and for a homosexual couple intending to reach parenthood. For both the aforementioned scenarios, sexuality, religion, and level of religious belief depicted statistical significance as non-heterosexuals, non-religious believers, and more liberal believers showing a higher level of acceptance. Furthermore, when the use of surrogacy is considered in order to circumvent the cosmetic effects of pregnancy, level of religious belief, sexuality, and religion showed significant difference in results, with liberal believers, non-heterosexuals, and non-religious believers accepting its usage with predominant rates. So in conclusion, non-heterosexuals, Buddhists, and respondents with liberal religious beliefs were more open-minded towards the application of surrogacy in impactful practical situations. So this may have significant socio-cultural impacts on acceptance and normalization of third-party reproductive methods, such as surrogacy, even with well-established legal settings. Thank you.
Abstract ID PP37, an anthropological overview of the birth control methods. Introduction. Birth control is designed to prevent pregnancy. It implies the ability of couples to anticipate and attain their desired number of children and the spacing and timing of their births. Family planning is important for the health of mother and her children, as well as the family's economic situation. The main objective of this research was to study the factors affecting to select the birth control methods. Purposive sampling method was used to select 30 married women between 20 to 40 in the Akaralla Gramanildari division. Results: 50% of the respondents have got the injection as the birth control method. 38% of them has used the traditional methods and 12% did not use any form of birth control methods. This study found that 95% of the participants have a fear about different health risk and side effect of modern birth control methods. They feared that the pills and the injectable could cause permanent infertility. In a study of 8 developing countries conducted in 2015, 50 to 70% of women thought that using the pill posed considerable health risk. Myths and misconceptions about the contraception methods can spread through informal communication via social network and lead to continued negative perceptions. Conclusion: socio-cultural factors such as religious and cultural rituals about sexuality and family and belief of contraceptive methods may influence the different patterns of contraception. Thank you.
Hello everyone, I am Jitman Etsara. I am a fourth year nursing undergraduate from Faculty of Allied Health Science, Kotalawala Defense University. Me and my colleagues conducted research on knowledge, attitude, and practice regarding periconceptional use of folic acid for the prevention of neurotic defects among childbearing age women in Borodaskamwa MOH area, Sri Lanka. Neurotic defects remain a major public health burden globally. In Sri Lanka, the estimated prevalence of neurotic defect is 1.21 per 1,000 births and recurrence risk of NTDs as 2% to 3%. Periconceptional folic acid consumption is the golden method to reduce the risk of NTDs. Enhancing knowledge on periconceptional use of folic acid is important. Our objective is to determine knowledge, attitudes, and practice regarding periconceptional use of folic acid for the prevention of neurotic defects among childbearing age women in Borodaskamwa MOH area in Sri Lanka. Our study design is descriptive cross-sectional study. Our sampling method is systemic random sampling method. Results. Out of 422 participants, the majority was Sinhalese and unemployed. The mean age was 32.02 plus or minus 8.625 years. Nearly 56% had heard about NTDs and 95% were heard about folic acid. Gynecologists and midwife were the main source of information. Almost every participant had positive attitude. The majority, 61.1%, had taken folic acid and only 42.4% had started folic acid before pregnancy. More than half, 55.5%, had good practice. Age, marital status, parity, educational qualification, monthly house income, and health service were associated with the knowledge. Conclusion and recommendations. Majority of participants had positive attitude and good practice level, but they had inadequate knowledge regarding periconceptional use of folic acid. More educational programs and programs are recommended regarding periconceptional use of folic acid to the women in childbearing age. Thank you.
This is the research poster regarding the research title of Association between Unexplained Infertility and Sedentary Lifestyle Behavior among women in urban city of Colombo, infertile female versus fertile female. When it comes to the introduction, infertility is defined as the absence of conception after 12 months of regular unprotected intercourse. Unexplained infertility is the infertility that is idiopathic in the sense that its cause remains unknown even after an infertility workup. When it comes to sedentary lifestyle behavior, any waking activity such as sitting or leaning with an energy expenditure of 1.5 metabolic equivalent task or less is considered as sedentary behavior. The main objective of our study was to identify the association between unexplained infertility and sedentary lifestyle behavior among young female population in urban city of Colombo. When it comes to the methodology, a case control study was conducted among 250 women. Each group we used 125 study sample in the age group of 18 to 32 years old at 3 government hospitals in Colombo district. Demographic data and medical history of the woman was collected in an interview administered female infertility questionnaire form and then to evaluate its physical activity level. International Physical Activity Questionnaire short form was used and we got the body mass index and the skin fold thickness also. Data was statistically analyzed using SPSS software version 23 using Pearson chi-square test. When it comes to the results and discussion, table number 1, according to the Pearson chi-square test, we got the p-values of PMI and infertility 0.011, SFT and infertility 0.000, IPAC score and infertility 0.000. In here, odd ratio is 11.87. It's a larger value. That means the sedentary lifestyle behavior is a good predictor of unexplained infertility in women. Finally, we determined our primary objective, which is there is association between unexplained infertility and sedentary lifestyle behavior among women in urban city of Colombo. Thanks.
I am Dr. Inoka Lienige, Medical Officer of Health, Borlasgamo area. Disruption to family planning services during the COVID-19 pandemic. Experience in a selected medical officer of health area in Colombo district. Disruption of family planning services has been reported during the period which the curfew has been imposed to curtail the spread of COVID-19 in Colombo district, Sri Lanka in March 2020. Our study objective was to analyze the effect of COVID-19 pandemic on provision and utilization of family planning services at field level during the curfew in a selected MOH area in Colombo district. Descriptive cross-sectional study was done in Borlasgamo Medical Officer of Health area by using the monthly returns of public health midwives for the second quarter of 2020 compared with that quarter of 2019. Two proportions were analyzed using chi-square test. Results found total number of eligible couples and the modern method prevalence were the same for the 2 years. Significant reduction were observed in the new acceptance rate of oral contraceptive pills, intrauterine devices, subdermal implants, and condoms. Those differences were statistically significant. New acceptance for the Depo-Provera injectable did not show a statistical significant reduction. There was a 31.2 reduction of total percentage of new acceptors for the year 2020 compared to 2019. That was statistically significant. My conclusion is significant disruption of family planning services occurred during COVID-19 pandemic at the field level in 2020 March. Thank you.
Hello everyone, I am Mayuri. I am a fourth year medical undergraduate from Faculty of Medical Sciences, University of Sri Jayawardenepura. Me and my colleagues did a study on knowledge and attitudes on complementary feeding practices and its associated factors among preclinical medical undergraduates of a state university. Complementary feeding is crucial in growth and development of infant and young children. Knowledge and attitudes on complementary feeding among future medical professionals is important in this context. Our objectives were to describe the knowledge and attitudes on complementary feeding practices and its associated factors. Methodology: a descriptive cross-sectional study was conducted among a convenient sample of 205 medical undergraduates. We collected our data via Google Form questionnaire. We analyzed our data by using SPSS software. High-score test, correlation, and independent sample t-test were used for inferential statistics. The level of significance was considered as 0.05. The majority of the participants were females. 64.39% had good knowledge, while 50.7% had good attitude regarding complementary feeding practices. The knowledge and attitude score among females were higher compared to males. Ethnicity and religion were found not to have any association with knowledge and attitudes on complementary feeding methods. So our conclusion is, knowledge and attitudes on complementary feeding among preclinical medical undergraduates needs to be improved. Thank you.
Greetings to all of you. I am Chamodini Shankar, presenting the research abstract on association of screen time with body mass index and the level of physical activities among a group of school children aged 11 to 14 years in the MOH area. Addiction to the screen devices is a common scenario among the adolescent population. So we have conducted a descriptive cross-sectional study to assess whether there's an association between the screen time, body mass index, and their physical activities. For this, we have selected 6 government schools from the MOH area and recruited 374 students as our study population. We have calculated their BMI after measuring the weight and height of every participant, and the screen time and the physical activities was assessed by providing a self-administered questionnaire and the frequency distribution of the data we gathered from that. So in our results analysis, we can see that majority of our study population belong to the low screen time level category, and majority also belong to the high physical activity level category. We also discovered that there's a statistically significant association between the screen time and the BMI, where among the students having high level of screen time, majority belong to the overweight or obese category of BMI. And also at the same time, there's a statistically significant association between the screen time and the physical activity level, where children having high screen time level also have a low physical activity level. So at the end of our research, we have concluded that there's a complex association between the physical activity level and the screen time level, which are both important determinants of the BMI of this adolescent population. Thank you very much for listening.
Hello everyone, I'm Joy Singha. My presentation is on attitude towards the care of dying patients, a cross-sectional survey among nurses at Colombo South Teaching Hospital, Sri Lanka. Care of dying patients involve optimizing the quality of life both terminally ill patients and their families. Nurses are the largest group of health professionals in health sector and often coordinate with patients and families. Nurses' attitude towards the dying care have an impact on quality of care provided. The objective of the study to assess the attitude level towards the dying patients among nurses at Colombo South Teaching Hospital, Sri Lanka. It was a descriptive cross-sectional study conducted among 104 nurses in Colombo South Teaching Hospital, and we used simple random sampling method and pre-tested questionnaire with FAT code 30 item scale We used descriptive and inferential statistics, and the study was ethically approved. Mean age of the participants 30 years old, and majority were female unmarried Buddhist participants. Majority were experienced less than 5 years in their profession and currently practice in medical, surgical, and ICU settings. A positive level attitude towards the caring for dying patients was reported among 80% of nurses with a mean of 85, and negative level attitude was not reported. The level of attitude was associated with religion, and it was not associated with the gender, age, working experience, education level, and marital status. So moving to the discussion, the favorable attitude level, good and moderate level attitudes towards the palliative care is commonly reported, and the level of attitudes has been associated with the qualification, experience, and receiving palliative care training. Similar findings is reported in the current studies also. However, in current study, working experience was not associated with the level of attitude, and religion was associated with it. So I would like to conclude that nurses' attitude towards the care of dying patients are favorable, and strategies need to be taken to improve it. Thank you. Have a nice day.
Anticoagulants and antiplatelet drugs, commonly aspirin and clopidogrel, are used as single agents or in combination in the treatment of patients with cardiovascular disorders. In our study, the objectives were to describe the frequencies, indications of use, and the incidence of gastric complications and bleeding among cardiology patients. It is a descriptive cross-sectional study involving 180 patients attending cardiology clinic at Colombo South Teaching Hospital using an interviewer-administered questionnaire and clinic records. 43% were on dual antiplatelets, 18.3% on aspirin monotherapy, 10.6% on clopidogrel, only 4.4% on triple therapy. 21.1% on warfarin alone, 0.6% on clopidogrel and warfarin, and 1.7% on aspirin and warfarin. Use of dual antiplatelets was much less than other countries, but matched one study in international literature. Among indications for dual antiplatelet therapy were STEMI and non-STEMI, followed by unstable angina. The most used indication for both aspirin monotherapy and clopidogrel monotherapy was secondary prevention in unstable angina, and that for triple therapy was STEMI with atrial fibrillation, and that for warfarin alone was atrial fibrillation. 72 of 142 patients on antiplatelets had dyspeptic symptoms, and 14% had undergone upper GI endoscopy. Among patients on antiplatelets, only 12.3% experienced any kind of bleeding manifestations, and most of them were gum bleeding and skin bruising. Of the patients who were on warfarin with or without antiplatelets, 24% had bleeding manifestations, but only 2 needed hospital admission. In conclusion, most cardiac patients are on dual antiplatelet therapy followed by aspirin or clopidogrel monotherapy and warfarin alone. Only 4.4% were on triple therapy. A significant percentage experienced dyspeptic symptoms even with the use of gut protection and required upper GI endoscopy. Bleeding is limited to gum and skin in both groups, with only 2 patients experiencing severe bleeding requiring hospital admission. Thank you.
I'm Sandhani Abesinevi. I'm here to brief you all on our research, proportion of anemia during first trimester and its associated factors among pregnant mothers attending antenatal clinics in selected MOH areas. Anemia in pregnancy is one of the commonest nutritional deficiency disorders affecting pregnant women in developing countries. Maternal anemia has a significant impact on the health of both mother and the fetus. Our study was done to determine the proportion of anemia during the first trimester and its associated factors among pregnant mothers. So we conducted a descriptive cross-sectional study among consecutively sampled 150 pregnant women in their first trimester attending antenatal clinics at the Hivala and Morlasgamo MOH areas. We excluded women below 18 years of age from our study. A pre-tested interviewer-administered questionnaire and a data extraction sheet were used to collect data pertaining to social demography, dietary patterns, and antenatal management. The data was analyzed using SPSS version 25. At the end of our study, we found that the proportion of first trimester anemia was 27.8% and that the anemia was more prevalent among unemployed women than employed. Statistically significant higher prevalence of anemia was found in pregnant women with rare consumption of green leaves and meat or fish. Higher proportion of anemia was observed among women who consumed tea within 1 hour of main meals. No significant association was found with consumption of milk, preconception folate, or food aversion or vomiting during the first trimester. Socio-demographic factors including educational level, monthly income, number of children in the family didn't demonstrate a significant association. So in conclusion, consumption patterns of certain food items like meat or fish, green leafy vegetables, and tea are significantly associated with first trimester anemia among urban Sri Lankan women, indicating the need for proper intervention to address females' nutritional habits. Thank you.
Hello everyone, I am TLC Lasantika, a postgraduate student of Faculty of Graduate Studies, University of Sri Jayawardenepura. This presentation is based on the study titled Cultural Adaptation and Content Validation of End-Stage Renal Disease Adherence Questionnaire for Sinhala-speaking patients receiving hemodialysis in Sri Lanka. Hemodialysis is the most common and affordable form of treatment strategy among patients diagnosed with end-stage renal disease. There are limited instruments are available in Sri Lanka to measure treatment adherence behavior among patients receiving hemodialysis. Therefore, current study aims to translate, culturally adapt and content validate the Sinhala version of end-stage renal disease adherence questionnaire for use in Sri Lanka. As you see in the methods section, the translation and cultural adaptation of end-stage renal disease adherence questionnaire original version was followed. The steps of forward and back translation, expert committee consolidation, and pre-testing with panel of patients. Then final translated and cultural adapted Sinhala version of end-stage renal disease adherence questionnaire was evaluated for its phase and content validity with a group of patients and panel of experts respectively. Each item of final Sinhala version of end-stage renal disease adherence questionnaire was rated in 4-point Likert type scale ranging from highly relevant to not relevant to measure adherence behavior among patients receiving hemodialysis. Based on the ratings of the experts, item level content validity index, item level content validity ratio, and modified kappa statistic coefficient were calculated in order to evaluate content validity of the final instrument. As you see in the results section, all the indices were showed good content validity of the final Sinhala version of end-stage renal disease adherence questionnaire for use in Sri Lankan hospitals. Thank you very much.
Hello, I'm Shanika Panagoda, nursing graduate from University of Sri Jayawardenepura. I'm going to present you my research study. Topic is physical activity pattern, 6-minute walk test and glycemic control amongst type 2 diabetes mellitus patients attending selected clinics in Mathura district, Sri Lanka. Firstly, let's know background. Regular physical activity is known to contribute to better glycemic control amongst diabetic patients. The 6-minute walk test is a useful measure of physical fitness that can be conducted in resource-poor clinic settings. However, the level of physical activity and its association with glycemic control amongst Sri Lankan type 2 diabetic patients is not known. The aim of the study was to determine physical activity pattern, glycemic control, and 6-minute walk test distance values of adults with T2DM. Let's move methodology. This was a descriptive cross-sectional study. Setting was diabetic clinics at Dengai Base Hospital. The study population was patients diagnosed with T2DM attending diabetic clinics and healthy adults. Convenient sampling technique used. Data collected by using interview-administered questionnaire and 6-minute walk test. Collected data analyzed by SPSS version 26. Ethical approval granted from Faculty of Medical Sciences, University of Sri Jayawardenepura. Let's move results and discussion. Table 1 shows you baseline characteristic of the study. Participated female are higher than males in both groups. The mean age of T2DM patients and control subjects were similar. Table 2 shows you mean fasting glycemic level from milligram per deciliter. This level of the T2DM patients was significantly higher than control subjects. Table 3 shows you mean total physical activity score of T2DM patients and controls. This score of the male and female T2DM patients were significantly lower than the male and female control subjects. Figure 1 shows you mean 6-minute walk distance in T2DM patients and control subjects. The mean measured 6-minute walk distance of the male and female T2DM patients was significantly lower than the male and female control subjects. Only 21.7% of T2DM patients had good glycemic control. The capacity to engage in brisk physical activity as determined by 6-minute walk distance was poor among T2DM patients. The 6-minute walk distance and glycemic control were highly correlated and statistically significant. Finally, let's move conclusion of the study. The glycemic control of these T2DM patients was poor. T2DM patients should be motivated to engage in regular physical activity, which will enhance physical fitness and help attain better glycemic control. Thank you.
Hello, I'm HHND Damratna. On the behalf of my research team, I'm going to share our findings with you. The title on perceived barriers to adhere to post-CABG exercises among the patients who undergone coronary artery bypass graft surgery at Sri Jayawardhanapura General Hospital, Sri Lanka. The number of CABG surgeries performed worldwide are more than 8 lakhs every year. Exercise-based rehabilitation programs are more effective for patients with CABG surgery, but the problem is most of the patients do not adhere to the recommended post-CABG exercises. Therefore, we have conducted a study to identify perceived barriers to adhere the post-CABG exercises among the patients who undergone CABG surgery at a selected hospital in Sri Lanka. This is a descriptive cross-sectional study conducted among 384 patients who attended to the cardiothoracic clinic at General Hospital Sri Jayawardhanapura, Sri Lanka. A systematic random sampling method was applied to select the study sample. Researchers developed pre-tested interviewer-administered questionnaire was used for data collection. Data was analyzed by performing descriptive statistics. When it comes to the results, majority of the participants belong to the older adult age group. Female-male frequencies are nearly equal among the study population. Majority of them employed and married. When it comes to the perceived barriers to adhere the post-CABG exercises, we have identified fear to exercise, lack of energy, lack of motivation, lack of knowledge, lack of time, and lack of support as the most prevalent perceived barriers to adhere the post-CABG exercises. Almost all the participants had reported barriers to adhere the post-CABG exercises. Therefore, there is a need to implement intervention to encourage the post-CABG exercises. Thank you.
I am Dr. Chanak Liyanage, Registrar in Community Medicine. Today I'm going to present my study on number of inotropes used and the survival of septic patient admitted to ICU in District General Hospital, Polonnaruwa. Inotropes are agents administered to increase myocardial contractility. My general objective is to describe the association between the number of inotropes used and the survival of septic patient admitted to ICU in DGH Polonnaruwa. This was a descriptive cross-sectional study. A sample of 58 septic patients PHT was used. The study participants consisted of 60.3% males and 39.7% female. All the patients recorded the temperature more than 38 Celsius and around 80% of patients had heart rate more than 90 beats per minute. Around 85% of the sample had blood pressure less than 100/60 on admission to the ICU. Out of all, 65.6% survived, but 34% 0.5% was death. When we considering on the conclusions and recommendations, survival of septic patient is low with the use of multiple inotropes. There is a statistically significant association between the outcome and number of drugs. The number of deaths is increasing with the increase of number of inotropes. Thank you very much.
Hello everyone, I am Lakshmi Silva from University of Peradeniya. In this presentation, I am going to share the findings of a qualitative study exploring users' view of a nurse-led brief psychological intervention for those who have recently attempted non-fatal self-poisoning in Sri Lanka. Recent Sri Lankan data show that rates of hospitalization due to non-fatal self-poisoning have increased. Therefore, it is well worth exploring whether a brief psychological intervention would be effective in reducing suicidal ideation and improving coping skills in our population. The aim of this study was to explore the acceptability of a nurse-delivered brief psychological intervention for individuals who have attempted non-fatal self-poisoning. This was a qualitative study conducted as a part of a pilot randomized control trial. The intervention consisted of a counseling session delivered by a trained general nurse. 35 semi-structured in-depth interviews were conducted immediately after delivering the intervention at 6 months and 1 year follow-up. The qualitative thematic analysis generated 3 major themes. The first theme is positive feeling after participating in the intervention. Most participants had felt a sense of relief after participating in the counseling session. The second theme is usefulness of the intervention in dealing with future life stresses. This was commonly reported by the young group. However, older participants expressed uncertainty about whether it was of any help to them. The final theme is emphasize the qualities of the counselor. Participants highlighted that they felt comfortable to talk to the nurse as she was a friendly and trustworthy person equipped with professional skills and knowledge. Overall, the findings indicate that the brief counseling session delivered in this study was perceived to be acceptable and useful, especially by young and female participants. Further, the intervention has the potential to improve coping strategies for some groups at risk of future self-poisoning in Sri Lanka and suggested further exploration. Thank you.
I'm Sachinta Lapkadike from Faculty of Nursing, University of Colombo. The topic of our research study is explore the patient's experience during the awaiting period of open heart surgery. Open heart surgery is a stressful and unpleasant experience for patients which cause severe physical, psychological, and social disturbances. This study aimed to explore the experiences of patients who are awaiting to undergo planned open surgeries. This was a qualitative descriptive study. Data was collected from a convenient 150 patients who were admitted to the ward number 77 and 78 in Teaching Hospital Kandy 3 days prior to the surgery. Interviewer administered questionnaire was used to collect data, and SPSS version 22 was utilized to analyze the collected data. Here we can see the overall results of the study. 52% were expressed negative feelings of hospital environment. Moreover, they are willing to share their experience or the feelings with family members rather than healthcare members. However, 89% were indicated positively about the care received from the healthcare team members. Moreover, 82% were not satisfied with the information received by healthcare team, and 67% were not satisfied with the facilities provided by the staff to perform their spiritual activities prior to the surgery. As a conclusion, we can say that many of them have psychological disturbances and further not satisfied with the information received from the hospital staff. So, the relevant authorities can arrange tailored preoperative interventions to cope with the discomforts to have a better recovery. Thank you.
Knowledge, attitudes, and barriers towards evidence-based practice among government sector physiotherapists in Sri Lanka. Evidence-based practice is defined as integrating the best available research findings with clinical expertise and patient preferences. The study was conducted to assess the level of knowledge and attitudes on evidence-based practice and to identify the barriers for implementing evidence-based practice among physiotherapists working in government hospitals in Sri Lanka. Methodology. The study design was a cross-sectional descriptive study, and the study sample was around 264. The study was conducted in 39 government hospitals. For the data collection tool, we have used a pre-tested, validated, self-administered questionnaire with 24 questions. And we divided those sections into 3 parts: knowledge section, attitude section, and barrier section. Data analysis. For the data analysis, we gather the information on knowledge, attitudes, and barriers towards EVP. Ethical approval was obtained from Faculty for Allied Health Sciences University of Peradeniya. As you can see, most of the participants are female, and it's around 156, and males have participated only 108. You can see most of the participants had positive attitudes towards evidence-based practice, and most of the participants had a good knowledge on evidence-based practice. The barriers for implement evidence-based practice were identified. The main barrier was identified as lack of time, and the second main barrier was lack of information resources, and this was the distribution across the country. The conclusion: the physiotherapists in Sri Lanka have a good level of knowledge on evidence-based practice and show positive attitudes towards implementing evidence-based practice. Recommendations provided enough human and physical resources to overcome the barriers.
Knowledge and practice of insulin dose adjustment among diabetic patients in teaching hospital Kerala. Management of diabetes is essential to prevent the progress of disease and its complications. Adequate knowledge and patients' healthcare on dose adjustment could facilitate improvement of their disease condition. Therefore, this study was designed to assess the knowledge and practice of insulin dose adjustment and association of factors among diabetic patients. This was institutional-based descriptive cross-sectional study, only includes adult diabetic patient on insulin more than 1 year. Pre-tested interval administered questionnaire was used. A predetermined cutoff value was used to categorize adequate or poor knowledge. A chi-square test was performed to determine the association between factors, and p-value of less than 0.05 was considered statistically significant. Ethical clearance was obtained from Ethics Review Committee, Faculty of Medicine. In this part, mean age of participants was 56.08 years. Out of 188 participants, 114 in 30 to 60 age group and 59.5% are female. Only 10.1% sought insulin dose adjustment on their own risk group. Knowledge and practice level on insulin dose adjustment were shown in this graph. 12.2% doing insulin dose adjustment on their own, and 4.2% had adequate knowledge on dose adjustment. Among the factors, age, educational level, duration of illness had statistically significant on knowledge. Finally, conclusion part, most patients had poor knowledge on insulin dose adjustment and did not change the dose of insulin on their own. Thank you.
Hello everyone, I'm Shivani Pereira from the 27th batch of the Faculty of Medical Sciences, University of Sri Jawaharlal, and I'll be presenting on the topic of comorbidities in determining the risk of obstructive sleep apnea. Very few studies have been conducted regarding obstructive sleep apnea in Sri Lanka. Hence, this research was done to understand the comorbidities of OSA. A descriptive cross-sectional study was conducted among clinic records with 101 randomly sampled patients aged 18 to 85 years who attended the sleep clinic from January 2019 to January 2021 and data was collected using a pre-designed record sheet. The risk of OSA was determined based on the comprehensive sleep assessment tests done at the sleep clinic. Inferential statistics was used to analyze the associated factors. The results showed that a majority of the participants had hypertension as comorbidity. However, the prevalence of diabetes and obesity was greater among those with the risk of OSA, but the difference wasn't statistically significant. In conclusion, diabetes and obesity were greater among those with the risk of OSA comparatively. Screening for OSA should also be performed on patients with diabetes, obesity in Sri Lanka. Thank you.
Hello everyone, I'm Lanka. Today I'm going to present the research presentation, the study on diagnosis and trends of treatment modalities among patients with endemic nephropathy in Vilkamoa, Sri Lanka. As you all know, early identification and adherence to suitable treatment modality is necessary to prevent morbidity and mortality among chronic kidney disease unknown etiology affected patients. Because of that, the aim of this study was to assess the CKD diagnosis status and trends of treatment modalities among endemic nephropathy affected patients in Vilkamoa. Actually, this is a descriptive cross-sectional study which was carried out among 293 CKD diagnosed patients. The mean age of this study cohort was 53.5 years, and this is a male predominant study because the male percentage was 75.8%. When considering the CKD diagnosis status, the majority of the patients, it means 46.4% of the patients identified from the government hospitals, and 41% of patients identified from MOH mobile clinics. At the beginning of this diagnosis, majority were, it means 50.5% of patients not engaged to any of the treatment modality. However, 41% of the patients moved for modern medicinal practices. According to all these results, we can conclude that establishment of suitable screening interventions and optimizing program is important to manage CKD health problem in Sri Lanka. Thank you.
Neuronal activity of the brain during Vipassana mindfulness meditation. Marasing MGCP, Tennakon V, Mahavitanage SDC. Mindfulness is the non-judgmental awareness of the present moment. EEG is widely used to analyze the electrical changes of the brain during meditation. No research is published assessing neuronal activity of the brain using EEG during Vipassana mindfulness meditation among Buddhist monks. The objective of this study was to identify the EEG patterns of Buddhist monks during Vipassana meditation. A continuous 40 minutes EEG recordings were obtained from 18 Buddhist monks from Mitirigala Nissaranavanaya, a forest monastery, during Vipassana meditation sessions. Artifact-free 60-second epochs of the first 5 minutes and last 5 minutes were analyzed using Slorata, a statistical software. Results. The mean age of the participants was 41.4 years, and the total meditation hours was more than 12,500. We found significantly high theta and gamma 1 current densities at the end of meditation as compared with beginning. The best activation of both these frequencies was observed at Brodmann's area 9 of the medial frontal gyrus of the frontal lobe, which is shown in the figure A in yellow color. Conclusions. Frontal midline theta and gamma activation were observed during mindfulness meditation. Theta and gamma 1 are known to associated with cognitive control, relaxation, and heightened awareness. Brodmann 9 area is associated with sustained attention and working memory. Therefore, we conclude mindfulness meditation may help develop an awakened mind with attentive calmness. We express our sincere gratitude to most venerable Udayiriyagama Dhamma Jiva Mahatero
and all the participants. Thank you.
I am Dr. Shalini Pereira, and today I will be presenting this study on awareness and prevalence of thalassemia carrier state in a cohort of university students in Sri Lanka. Thalassemia is a group of blood disorders which occurs due to the globin chain production defects. This analytical cross-sectional survey was done in a group of randomly selected 384 consented students from University of Sri Jayawardenepura. A self-administered questionnaire was given to assess the demographic data and the awareness of thalassemia. And the initial carrier detection was done by a complete blood count, followed by a blood picture, and then finally quantifying the HbA2 levels by HbA1c. This study revealed that out of the 384, 321 students were normal and 11 were diagnosed as beta thalassemia minor carriers, with another 10 with beta thalassemia minor plus iron deficiency anemia. This brings the population of beta thalassemia minor to a total of 5.5%, which is higher compared to the previous studies. Also, another 15 students were possible alpha thalassemia carriers with normal iron studies and HbA1c. When we consider about the awareness, only 58.5% were aware of thalassemia minor, and out of that percentage, a significant 60% had a misconception that thalassemia minor is a symptomatic disease, and only 66.6% were aware about the importance of premarital screening in preventing thalassemia major births. Based on these study findings, the carriers were found in 15 districts out of 21 that were studies, which showed an emerging trend in Ampara, Puttalam, Badulla, Anuradhapura, and Mathalu. These results indicate that the satisfactory awareness of this serious health issue is very poor, and these findings should alert the authorities to take serious course of action to address the issue and promote awareness and knowledge to lessen the disease burden. Thank you.
Knowledge and attitude on management of critical laboratory results among medical laboratory technologists in southern province Sri Lanka. Introduction. Critical results may endanger a patient's life if immediate corrective or therapeutic measures are not taken. The present study aimed to determine the knowledge and attitude on the management of critical results among medical laboratory technologists in both government and private sector laboratories in southern province Sri Lanka. Methodology. A descriptive cross-sectional study was conducted using a pre-tested self-administered questionnaire. Sample size was 85. Purposive convenient sampling technique was used and data were analyzed using SPSS software version 21. Results. Among the study participants, majority were females. Among the study participants, 32.9% stated that there is a critical results management system in their laboratory. 42.4% stated that there is no critical results management system in their laboratory. 23.5% had no idea. Study participants were categorized based on knowledge scores. Participants who gained less than 50% were in poor knowledge category, between 50 to 75 average knowledge, between 75 to 90 good knowledge, more than 90 excellent knowledge. The mean knowledge score of the study participant was 42.2. There was no statistically significant difference in knowledge between MLTs with reference to their gender, age, or education. MLTs with more than 10 years of experience had a significantly higher knowledge score compared to MLTs with less than 10 years of experience. The overall attitude of MLTs on critical results management was satisfactory. Conclusion. The value of educational and training programs on critical results management and evaluation of their effectiveness is emphasized. These are my references. Thank you.
Good day, everybody. I'm proposing pharmacological interventions in substance use disorder rehabilitation in Sri Lanka, findings of a systematic review. So, despite of the available evidence about the pharmacological interventions for the drug use disorders, the usage of these pharmacological interventions in rehabilitation centers of Sri Lanka is minimal. Therefore, this review is directed toward gathering information about pharmacological interventions for opiate use disorders. A systematic review was carried out according to the PRISMA guideline, articles of year 2015 to year 2020 were selected for this systematic review, which were written in English. And according to the systematic review, the process was carried out according to this flowchart, and we were able to finalize 26 articles for the review. And from these 26 articles, we were able to identify newly emerging treatments, including prazosin and baclofen, and these were identified as the current available treatment interventions, which include buprenorphine, disulfiram, methadone, and also buprenorphine, methadone, lofexidine, and naltrexone showed mainly effective for the opiate-seeking behavior as well. In conclusion, methadone exhibits a comparatively high efficacy among reported interventions, and as authors, we suggest to use these pharmacological interventions in drug rehabilitation centers in Sri Lanka, along with the non-pharmacological therapy. Thank you very much.
Topic of my study is knowledge, attitudes and practices on vitamin D among medical and nursing undergraduates at the University of Sri Jayawardenepura. Vitamin D deficiency is a global issue. However, most are unaware of the burden and preventive measures. Main objective was to assess vitamin D related knowledge, attitudes and practices among medical and nursing undergraduates at the University of Sri Jayawardenepura. Study design was descriptive cross-sectional. Sampling method was non-probability convenient sampling. Study instrument is pre-tested self-administered questionnaire. Data analysis was done using IBM SPSS version 26.0 software. Response rate was 65.3%. Mean age of the participants were 25 years. Females were predominant. Mean knowledge and sources of vitamin D was 37.58. Only 26.2% were scored more than 50. 25.1% were concerned about their vitamin D levels. 1/3 of the population did not have adequate sun exposure. Common reasons for avoidance of sun were skin darkening and intense heat. Most expressed the need for vitamin D guidelines. Conclusion. Undergraduates demonstrated a poor overall knowledge of vitamin D and an inadequate sun exposure time. Increasing awareness of the burden and the preventive aspects of the vitamin D deficiency is required. Thank you.
I am Shamali Vijayakon. Our project is microwave-assisted solvent-free synthesis of 3-benzylidene indolene 2 on an investigation of in vitro antifungal and antioxidant activities. Fungal infections are becoming more severe day by day, leading to a significant global health crisis. Therefore, the development of effective antifungal agents in an environmentally benign manner is urgently needed. The present study is focused on the development of effective antifungal agents from oxindole and natural occurring aldehyde, which is benzaldehyde, using a microwave-assisted solvent-free green reaction method. In the methodology, oxindole and benzaldehyde was mixed with the suitable catalyst and irradiated inside a modified domestic microwave oven at high power for 12 minutes. The resulted product was characterized by different spectroscopic techniques, and their antifungal and antioxidant activities were investigated. The reaction completion and product formation was confirmed by till-layer chromatography, and the targeted compounds were obtained in high yield and high purity within short period of time under microwave irradiation. The resulted spectra confirmed the formation of targeted 3-benzylidene indolene 2-on. The antifungal activity of the synthesized compound was investigated against ATCC culture of 2 human pathogenic Candida species, and the antifungal activity test results confirm the synthesized compound show strong antifungal activity. The antioxidant activity of the synthesized compound was investigated by ABTS method, and the IC50 value was found at 200 microgram per ml concentration. Therefore, we can conclude that the synthesized 3-benzhydrazine 2-on can be effectively used in the future development of effective antifungal agents. Thank you.
Development of pharmacopoeial standards for me oil and Ayurvedic medicinal oil with anti-inflammatory properties. Me oil is a very important medicinal oil. In order to assure its quality, safety, and efficacy, it is needed to guarantee its composition. Hence, development of standard specifications is important. But however, the only local monograph available in Sri Lanka is in the Ayurvedic Pharmacopoeia, which was published in 1979, and it has never been revised for all these 40 years. Hence, the given standards in the monograph are not scientifically strong enough to assess the quality, safety, and efficacy of this oil. Hence, developing a pharmacopoeial monograph to establish reliable and scientific quality control standards using a combination of classical and modern instrumental methods of analysis has become a national necessity. Therefore, this is an attempt taken to fulfill that necessity. 2 me oil samples were collected from Kurunegala district and 1 sample from Anuradhapura district. The tests for these 3 samples were carried out in accordance with the general monograph for the fixed oils given in the British Pharmacopoeia 2016. Tests which were done include the characterization of the physical test parameters like appearance, solubility, moisture content, specific gravity, kinematic viscosity, refractive index, optical rotation, and chemical test parameters like the acid value, peroxide value, saponification value, and identification tests like the TLC and GCMS. Based on these results, the monograph was drafted, and the drafted monograph was shown under the results category of this poster. And according to the GCMS analysis results, 4 major fatty acids, ricinoleic acid, stearic acid, palmic acid, and linoleic acid were identified. Thank you very much.
Pharmacognostic study of endemic plant Hortonia angustifolia. Hortonia angustifolia belongs to family Monomiaceae and genus Hortonia, which is endemic to Sri Lanka. Though anti-cancer, antifungal, mosquito larvicidal activity of this plant have been reported, detailed pharmacognostic and phytochemical studies have not been reported yet. So our objective was to carry out pharmacognostic and phytochemical characterization of the plant. First, we collect plant materials from a home garden near Singharaja Forest and authenticated by National Herbarium Peradeniya. Then, plant materials were dried and powdered to determine ethanol and water extractive values and to perform qualitative phytochemical tests. TLC profiles were also developed. In addition to above methods, quantitative microscopic analysis was performed to determine several leaf measurements using fresh leaves. Under qualitative microscopic analysis, permanent slides of leaf, bark, and roots were carried out. And also we studied powder microscopy and powder characters with different chemical reagents. From the above methods, we determined that water extractive values were higher compared to ethanol extractive values in each plant part, and highest extractive values were shown in leaves and lowest in roots. These are the secondary metabolites identified through qualitative phytochemical tests. These are pictures of TLC profile. This table presents average values obtained for different leaf measurements. Here are some microscopic images and powder microscopic images. The finding of this study will serve as a valuable tool for authentication and detection of adulterants of Hortonia angustifolia. Thank you.